Thank you, Madam Chairman. And may I move the motion that this House has considered the vaccination of children against Covid-19. On the 3rd of September, the JCVI announced that they were unable to recommend the mass vaccination of healthy 12 to 15-year-olds. The reason for this was that although there are marginal health benefits of COVID vaccination to children based on the known risks of the vaccine, there is considerable uncertainty regarding the magnitude of the potential harms, such as the long-term effects of myocarditis. Writing in the Sunday Times, paediatrician and JCVI member Adam Finn says, "A high proportion of myocarditis patients show significant changes of the heart. It is perfectly possible that these changes will resolve completely over time, but it is also possible that they may evolve into longer-term changes. There is no rush to roll out the vaccine to children. We know that children are not at risk from COVID. Teachers are no more at risk than the rest of the population. The vast majority of vulnerable adults have been vaccinated. Over half of children already have antibodies, and there is no evidence that schools drive transmission. It's also unlikely that vaccinating children will have a major impact on infection rates in the population as a whole. With the JCVI saying that, the committee is of the view that any impact on transmission may be relatively small, given the lower effectiveness of the vaccine against infection with the Delta variant. But instead of accepting the JCVI's assessment and waiting for more evidence to emerge, the government asked the Chief Medical Officer urgently to review the decision based on the wider benefits to children, including to education. And last week, the CMO announced that he would recommend child vaccinations on the basis of these wider benefits. This is a marked departure from the principle of vaccinating people for their own medical benefit, because these wider issues, educational disruption and concerns around mental health, are the consequences of policy decisions and not scientific inevitabilities. Children in the UK have already missed more education than almost any other country in Europe, despite comparable death rates. Since January 2020, British children have lost, on average, 44% of school days to lockdown and isolation. This is not a consequence of COVID infections in children, but rather a result of policy decisions to close schools and isolate healthy children. According to the government's own modelling, the vaccine could lead to 41 days of schooling saved per 1,000 children between October and March. This equates to an average of just 15 minutes of education saved per child over this period, surely an insignificant amount and negligible once accounting for the time taken to vaccinate and subsequent days off school to recover from potential side effects. There is a much more simple way to stop harmful educational disruption, and that is to follow the advice of the Royal College of Paediatricians and end the mass testing of asymptomatic children. This unevidenced and unethical policy is costing tens of millions of pounds a week. I'd be grateful if the Minister could confirm the exact cost, and is continuing to disrupt education. Even the CMO acknowledges that a vaccination programme alone won't stop school closures. So perhaps the Minister could clarify how the government does intend to end educational disruption. And on the potential mental health benefits from reducing the fear of COVID, it isn't COVID infection that is causing children fear. It's the uncertainty, frustration, loneliness and anxiety that they experience as a result of lockdowns and harmful messages such as "don't kill granny." Children need not fear catching COVID, but they have every right to fear policy decisions that cause them significant harm. For no other cohort has the government questioned the JCVI's advice. Why have we departed from this stance when it comes to children and looked for reasons other than direct medical benefit to press ahead? When there are concerns about future health of our children, why haven't we waited for more evidence to emerge?
Together, and I want to refer to 3 words today that I hope the Minister and her colleagues in government take notice of. Do no harm. Regardless of the Chief Medical Officer's overruling of the JCVI, I would say when it comes to our nation's children and our young people, those in those roles should remember that their actions should do no harm. It is again a fallacy that such direction that this government wishes to take will protect our children, and especially as 50 to 70% of those are already likely to have had contracted and survived COVID-19, according to the ONS. And so are we really showing that we are doing no harm? And any vaccination programme, we are told, would not negate potential future school closures. So what is the point? Where is the political backbone? As no trials have been made public that are definitive, I fail to see how any child below 16 can be fully informed about the safety or otherwise of these vaccines, particularly in light of the heart impacts on young males and the reported effects in over 35,000 females of reproductive age reported in the UK national media this very last weekend. There is no medium or long-term study data. Perhaps there are heart risks for males as a real concern, and reproductive females are suffering side effects. How does the Minister square that circle that we should do no harm to a young of the UK, the next generation, who will be paying for this government's and Minister's decisions for many, many years, and I fear perhaps in more ways than one? Thank you.
And at the beginning, the vaccine rollout was understood. January earlier this year, December last year, the vaccine programme was being pitched as to treat and protect the most vulnerable, those who are old, those who have particular challenges with health. And then before we knew it, the ages were coming down and down and down. In many ways, we can objectively say we are almost through the worst of the pandemic, and yet the more draconian or authoritarian measures are being introduced at this stage.
The JCVI's recommendation on mass vaccination of children aged 12 to 15 is clear, and quote, "The margin of benefit in vaccinating healthy to 12 to 15-year-olds is too small to support such a policy." If it's because of extraneous factors that have been mentioned in recent days, such as protecting children's mental health and ensuring they miss no further school, then it must be said of both of those problems that they have their root in government decision-making. School closures are a political choice. Testing regimes are a bureaucratic insistency from the Department for Education. The fear some children may have of dying from COVID-19 has come from a created climate of fear, because the evidence shows that both children who are perfectly healthy and those who've got some underlying health conditions face a mortality rate from COVID-19 of 2 in every million. Children are therefore not at risk of death or serious illness from COVID-19. In fact, most children are either asymptomatic or experience a mild illness. Given most vaccines don't prevent transmission, and those most at risk due to age or underlying health conditions have been double vaccinated, this recommendation is not only unnecessary, it could be dangerous. We should be protecting our children and not taking unnecessary risks with their health in favour of some vague notion of perceived benefits to wider society. It's also important to remember that any child who gets seriously ill or, heaven forbid, dies from a vaccine does so because of a policy decision and not a disease. We're rapidly descending a very slippery slope, and it's a mistake to allow children to circumvent parental control, especially when the long-term consequences of these vaccines are not yet clear. There's been very limited research and data collected on the efficacy and safety of these vaccines in children.
And I feel uncomfortable with it. I feel it feels wrong, and I believe it's wrong to be introducing this vaccination programme for children 12 to 15 with all the kind of things we said about consent this morning. And so why now is it that with the help of the CMO, the Chief Medical Officers, the government rejects the advice of the GCVI, which has said, and we've heard it already, the margin of benefit is too small to support advice on a universal programme of vaccination of otherwise healthy 12 to 15-year-olds. And they also say any impact on transmission may be relatively small in terms of disruption to the children's. In other words, schools would still be disruptive because of the vaccine doesn't actually really manage transmission. Please can we get back to just giving vaccines because of that individual's health, not to protect the school environment, the community, or even, dare I say it, the economy. Thank you, Dame Angela.